The Bowen Theory, Midwestern State University. Presentation by Jennifer Satterfield and Laura Taylor. The Bowen Family Systems Theory is a theory of human behavior that views the family as an emotional unit and uses systems thinking to describe the complex interactions in the unit. It is the nature of a family that its members are intensely connected emotionally. The connectedness and reactivity make the functioning of family members interdependent. A change in one person's functioning is predictably followed by reciprocal changes in the functioning of others. Knowledge of how the emotional system operates in one's family, work, and social systems reveals new and more effective options for solving problems in each of these areas.
This is what Bowen observed. Two parties start a relationship. When anxiety or tension enters in and is not resolved, family projections begin. When the anxiety is too great for the individuals to resolve, it manifests in four ways. First, conflict in between the matrimony. Second, symptoms in one spouse carrying all the anxiety. Third, projection of the problem to other family members. Fourth, completely cutting off contact with the other person. This emotional cutoff occurs when individuals distance themselves physically or psychologically in order to manage their unresolved emotional issues with family members by reducing or totally cutting off emotional contact with them. Examples of this is retreating to their room or special place and avoiding sensitive topics. The most common subconscious reaction is to project the hurt emotions onto a third party. The third party is now brought into the conflict by the second party, usually unbeknownst to the first party. The third party can be a pet, a member of extended family, close friend, or coworker. This is what Bowen called triangularization. It is a manipulation tactic where one person will not communicate directly with another person, but instead uses a third entity to relay communication to the second, thus forming a triangle. The hurt is kept alive between parties 2 and 3, but the initial conflict is never healed between party 1 and 2. Bowen believes that triangles are the building block of larger emotional systems because it is the smallest stable relationship system. He considers a two-person system to be unstable because it will tolerate only a little tension or anxiety before involving a third person. When the third party is a child of the parents, Bowen calls it family projection. In this way, the parents' patterns for coping are passed down onto offspring. The child consequently gets drawn into or emotionally fused into the parents' relationship. This child will feel a responsibility towards the parents' emotional state, thus reaching what Bowen termed a high level of fusion. He maintains children grow up to marry someone on their same level of emotional fusion, thus creating a multi-generational transmission process. When society's emotional coping gets adopted into the family, that is called societal emotional process by Bowen. Another tenet of Bowen's is sibling position. People can develop fixed personality characteristics based on their functional birth order. Bowen stated there is a higher likelihood of natural success if individuals marry the opposite of their functional birth order. A youngest son marries an oldest daughter. Bowen's primary theoretical tenet and technique for therapy is self-differentiation, a level of maturity reached by an individual who can separate her or his rational and emotional selves, the opposite of emotional fusion. This includes the ability to distinguish yourself from your family of origin, which is a lifetime project for anyone. In fact, Bowen stated most people don't reach differentiation of self until age 25. Self-differentiation, there is a need to quantify. In order to provide a measure of emotional maturity or the degree of differentiation that shows the capacity of a person to manage his or her emotions, thinking, individuality, and connection to others, Bowen created a scale. Autonomy on one end, thinking through something logically with no emotions, all the way to the other end of undifferentiation, where there's an emotional dependency on family members, even if they live far away from their family of origin. Higher levels of differentiation are predictive of lower distress, greater well-being, and better marital quality. In life, there are counterforces of togetherness and individuality. This is where the client struggles to find their identity through the mix of family experiences, life experiences, and self-expectation.
What are you doing on the Xbox?
Nothing.
You don't have permission, do you?
Nope.
Mom, Becca's on the Xbox. Becca, are you reading before your schoolwork is done again? You know Mom's gonna take your book away. Mom! You missed a spot here, and you missed along this edge. You can't get under it?
What the heck, David?
And we have arrived on the communication couch. Becca, what are you feeling and why are you feeling it?
I'm feeling mad because David keeps on finding everything wrong with me.
David, what are you feeling and thinking?
Currently, I'm bored of this conversation. No offense.
Well, you can stay here for the next hour while the rest of us finish doing our jobs until you're ready for this conversation. Or are you ready now?
I guess I'm ready now.
And thinking.
I am feeling annoyed at Becca because she cheats every rule and then gets away with it.
Yeah, I do.
Okay. David, I'm not saying Becca gets away with everything or that she doesn't get away with everything. But why does that bug you? Whether she does or not. Why does that have control over you?
Because you were too busy with Grace to do it. No offense.
To do what?
To correct her. To help her learn not to do those things.
Okay. So in other words, this isn't actually a problem that you have with Becca. This is actually a problem you have with me.
Yes, I wonder how you know.
From this video, we can see many of Bowen's techniques applied. First, asking a multiplicity of questions about each family member involved, with multiple generations involved usually. Clients talk to the therapist and not to each other, as was shown in the video. Bowen Therapy also encourages person-to-person conversations that are sharing personal experiences that can build bonds of connection. This is usually done by using an I position, or an ability to make statements that express thoughts in a reasonable way that make others want to express their thoughts. Self-differentiation for this situation might look like this. Becca could be taught to self-differentiate herself from David by ignoring him and making wise choices. David's need to be authoritative could be investigated further to further eliminate his fusion with Mom. Mom stays rational when David expresses his feelings and emotions. The detriangulation that could occur in this situation is that David learns appropriate ways to talk to his mom about his concerns about fairness without being disrespectful or argumentative. Mom stays rational when David expresses his feelings and does not emotionally engage when he is critical of others. And Becca learns to submit to Mom's authority only.
Dr. Murray Bowen was among the pioneers of family therapy and the founder of systemic therapy. Born in Tennessee in 1913, Bowen was the oldest of 5 children. He grew up in a tightly knit family that for generations resided in the same small Tennessee town. Upon graduation, his relationship with his family resembled the term emotional cutoff. He would later coin the term in his professional career. Bowen went on to pursue a Bachelor's of Science degree from the University of Tennessee, Knoxville in 1934 and a medical degree from the University of Tennessee Medical School, Memphis in 1937. He then interned at Bellevue Hospital in New York City in 1938 and at the Grasslands Hospital in New York from 1939 to 1941. From 1941 to 1946, he served in the U.S. Army as a surgeon. It was while working with soldiers that his interest changed from surgery to psychiatry. When he came back from the war in Europe, he started at the Menninger Foundation, which was one of the first psychiatric hospitals in the U.S. This was where he gained his psychiatric training and experience and was there for a total of 8 years. From 1954 to 1959, he worked for the National Institute of Health, where he developed the Bowen Theory. He developed this theory after watching his subjects, which were primarily parents with schizophrenic children. There, he clearly defined the field of family therapy. He claimed that no one had done this previously, and within 2 years, family therapy became nationally known. Personally, he detriangulated himself with his family in Tennessee. Bowen returned home to see his family, but reacted cognitively and neutrally to a number of emotional issues family members presented to him. It is said that Bowen's experience growing up in a small town is what attributed to his theory. From 1959 to 1990, he was the professor of psychiatry at Georgetown University. He became a clinical professor, was director of family programs, and in 1975 founded the Georgetown Family Center. Also, he founded and was the first president of the American Family Therapy Association in 1978. Dr. Bowen was the director of the Family Center at Georgetown University until his death in 1990.
Bowen's theory is best used with multi-generational, highly fused families. Think soap operas. Because Bowen maintained that most conflicts in families are repeated patterns that go back for generations, he advocated using a genogram. This uses geometric shapes to show the family history of a family. It can track patterns of illnesses, occupations, genders, ages, ethnicities, death, drug use, cultural factors, even spirituality. Repetitive patterns become obvious and impersonal for the family members. Triangles, coalitions, coincidences, off-schedule events can be a journey of self-discovery and reconnecting as the family members have a first experience with self-differentiating themselves by assigning an emotion to a circle or square on the paper. Genograms empower clients to not be victims of their patterns and act in the present. This is a genogram of a family showing triangles and disconnection patterns. Bowen recognized the patterns in his genogram and in his personal family, so he coined the phrase "going home again" as the cure for emotional cutoff, where you take ownership of only your own personal emotional responses to family members while re-engaging and connecting with family. He used this technique himself and went home to test his own self-differentiation and heal his emotional cutoff with his parents. But eventually, he avoided his home altogether.
With us being the first presentation, I kind of debated on how to do this, but kind of made a list of pros and cons of the Bowen theory that I see as helpful to our classmates. So, first of all, detriangularization is what helps clients separate their feelings from their intellect and helps them to not have an emotional dependency on family members. Being independent is something we talk about a lot in the theories class. Clients with strong autonomy tend to be able to make decisions better for improvement on their own. Self-improvement includes being able to separate feeling from thinking, which is an important life skill to have. Hooper and DePie in 2010 said that more differentiated individuals have both a closeness to and a separation from their family of origin and are less influenced and reactive to others' behaviors and opinions. This could bleed into a lot of different areas and be potentially helpful. Family projection, according to the Bowen Center, said that families produce offspring at the same level of differentiation as themselves. No shock to you, I'm sure, but those individuals with more self-differentiation from their family of origin will cope better in marital issues because they are less reactive, and they may also experience greater levels of marital satisfaction. As Jennifer spoke previously about, genograms are helpful because it puts the client outside of the situation that they're in and makes them kind of like a third party. When you see it on paper, it tends to not be so personal, but rather you see the symbols and the ties to the family history. For instance, the Georgetown Family Center did a study in 2010 with a therapist who practiced the Bowen Theory. This therapist did family diagrams, which are similar to genograms, with clients in premarital therapy sessions. This brought together a picture of two family systems and each person's family's emotional processes. The diagram provided evidence of how knowledgeable clients are regarding to their families, and it also hints how familiar or not familiar their partner is with the other's family. Bowen's attention to family history reiterates the fact that it is important for clients to avoid repeating negative behaviors in interpersonal relationships. It's all working towards improvement of the family system, regardless of the number of people in a session. And then last but not least, the emotional process in society, which some therapists using the Bowen Theory are insightful and accurate about sharing with the client what's going on with society at that time. The example in the book given was that after World War II, it was evident that there was an overall attitude society that was negative. It was said that Bowen was highly disinterested in labels, especially diagnostic labels. I think this could be potentially problematic for insurance purposes. Also, the Bowen transmission process, the coping strategies and patterns of coping with stress tend to be passed on from generation to generation, and this often could potentially put labels on families prior to their full potential. The main examples I could think of, and are probably already done naturally, are maybe labels that are given from medical providers or educators. Every client deserves a chance to have the opportunity to change if they choose to. The main criticisms that I researched and found most evident were there is a gap in the theory for families of color. One of the first to look at Bowen's theory and write on the importance of ethnicity being involved in family therapy was Monica McGoldrick, who viewed the shifting of our awareness of one's culture as essential to family therapy. Next, we don't see any evidence of families with members who identify as LGBTQ. This includes lesbian or gay parents or their children. One area of change that has been on the rise is publicly acknowledging same-sex households, especially those rearing children. There is still not a significant amount of research on working with families with members who identify as LGBTQ. They emphasize the need to expand beyond the base of knowledge that has begun to accrue about these families based primarily on middle-class, white LGBTQ families. Bowen's theory may not apply to a gay or lesbian couple and or family. In sum, much research should emerge about these families over the next 50 years. Questions might be, will acceptance continue to grow? If so, will LGBTQ families come to look like all other families, as Bowen suggested, or be distinct? According to Bowen, the therapist is a coach and educator. The role of the therapist is to ask questions until the client becomes self-aware, leading some clients to learn a lot about the past, but not necessarily dealing with their present situations. This is a significantly different approach than other known theories, where clients are typically encouraged to find their own solutions with the counselor's light guidance. And last but not least, all genograms are tangible and non-threatening in nature, but they also require extensive interviews of each family member. The availability of each family member or info about each family member is not realistic. In reflection, here are the main things you need to know about the Bowen theory. This theory is used best for heterosexual nuclear families. These families should know about their family's past physical, emotional, and psychological histories. Bowen's focus is not the interpsychic experience of the individual. It focuses on the structure and workings of the system so that the individual can forge a different systemic role. The therapist is a coach and educator. Therapists use techniques while in a helping position, but their job is to get the family into a position to accept responsibility for its own change. And successful treatment with families from a Bowen standpoint is that families also understand generational patterns and gain insight into historical circumstances that have influenced the ways they presently interact. Awareness of generational and personal behaviors gives clients the freedom to choose how they will act.
Hello? Can I use some help?
Ooh, red.
Hey! It's my bread, and I could really use some help if we're going to be out on time.
What?
I said I could really use your help, and that's my bread.
I'm busy.
On video games?
I'm doing something, so therefore I'm busy.
I saw the change in Rich when we moved into the new house, but having his parents over was enlightening.
You don't like my lasagna?
No, it's good.
Here, blow. Blow on it.
You see it, right?
Is there a draft in here? I'm telling you, it's so easy to get home insurance on Progressive.com.
Progressive can't save you from becoming your parents, but we can save you money when you bundle home and auto.